Hello. All right, so my name is Ashley Hatfield, and I research predictors in effective drug and alcohol policies, specifically prevention. And I decided to focus on finding out what makes drug and alcohol prevention policies effective, along with what legislation proposals are most likely to be passed. This is something I'm interested in because I am passionate about prevention. I have given many presentations at Snow College, where I got my associate's degree as a wellness advocate there, and I learned a lot about prevention and how it can be a powerful tool in helping heal communities and people before they even get sick or before they even have to struggle with issues. So a little bit of history is that prevention policies have kind of impacted social work history in a lot of different ways because drug use prevention attempts span back as far as the 1800s with anti-opium laws. Drug prevention really came into the public eye in 1970 when President Richard M. Nixon signed the Controlled Substances Act into law in 1970. And this classified drugs into different medical application categories as well as it um, classified certain drugs by potential for abuse. In order to stop the spread of coca and opium, the U.S. drug policies supported military operations in all different parts of the world, and this was controversial because of how the military treated the locals and the people who cultivated coca. President Bill Clinton, he's the one who actually sent the military, and yeah, it was all pretty controversial. It's called the Merida Initiative, and it was launched by President George W. Bush to step up anti-drug initiatives in Mexico, and it has drawn criticism for the same reasons that I mentioned above. It's also important to note that the DARE program came from this new push for prevention in the 80s, and that is a failed attempt because it didn't help at all in any aspect of prevention. So a version of the United States government's drug policy was issued on May 21st, 2012, and this is distinct or different from the war on drugs that I mentioned from Nixon. And this strategy is viewed as the third way approach to drug control. And this is based on extensive research from some of the top experts on the disease of substance abuse. Research about effective prevention education is somewhat new. Just recently, the American government produces funding to create and spread scientifically proven addiction treatments. These awards have produced a number of behavioral therapy approaches that need a support, including community reinforcement approach and the community reinforcement and family training approach. So all of this history and this topic impacts social welfare agencies because the government gives funding to these agencies, and a lot of these agencies can't even function without government funding, sadly. And this is good because it allows people to be able to access resources maybe wouldn't be able to pay for the treatments and the preventions without that. Treatment is more heavily funded and understood, but prevention work is gaining more and more traction as evidence for its effectiveness is being showed and proven. The National Association of Social Work Ethics applies to drug treatment and prevention mainly because of the importance of human relationships that's emphasized. According to the NASW website, social workers seek to strengthen relationships among people in a purposeful effort to promote, restore, maintain, and enhance the well-being of individuals, families, social groups, organizations, and communities. Prevention is key to all of this because it keeps not only communities healthy, but on an individual level as well, all the way up to families and then communities and then the nation. All right, so now I will get into my model up here and actual research I found. So as you can see, I have positive predictors in effective policies and maybe some barriers in that policy. So my first positive predictor is high intensity research. So I said this is my first predictor because it's kind of the beginning stages is policies that are based on high intensity research are proven to be more effective in the long run and are able to reach more people. They're well thought out and they're more trustworthy. The second positive predictor is adequate funding and resourcing. So programs that have enough funding and enough resources obviously do better. My third predictor is external communication and relationships. So this is individuals who are able to have more connection to the outside world and more support from maybe family, friends, social workers, people like that. And the fourth positive predictor is sensitivity to service users and settings. And this one's really important because everybody has different backgrounds, has different needs, and appealing to individual strengths and sensitivities to maybe their cultures and different things that could be barriers ensures the best help for those people. Now I'll talk about some of the barriers in the policies that I have written and found in my research is that identifying and retaining personnel. So this goes both ways for social workers. It is hard to get people to work on these programs because they're often long-term. It's hard to see the results of them. And it's hard to get people in these prevention programs and to keep them in these programs. The second barrier is engaging communities and partners. So it's often hard to engage different organizations and different communities to be all in because it's often added work to people who are already overstressed and really busy. Barrier number 3 is project planning and design. This is a huge barrier because it can have the best intent, or a policy may have the best intentions, but if the planning and design can't even make it, or if it's ineffective, then the whole program will be ineffective. All right, so I'll talk about what are the common factors in previously passed policies. So it's, what if you make a policy with all the positive predictors, high intensity research, adequate funding, external communication and relationships, and sensitivity to service users and settings. And what if you want to get it passed? What do you have to do? Well, in a study that really evaluated, I think, over 100 different past policies in drug and alcohol prevention, it showed that these 3 factors were more likely to have legislators pass it. So the first one is relative advantage and compatibility. So this is pretty much cost versus benefits. Is it worth the resources and the money that's put into this versus the outcomes? So for example, policies, one of the examples was neonatal care, because the benefits were worth the cost, saving babies' lives, right? Then that was something that was passed. And the second predictor is complexity. And complexity is often, this is from the study, the quote, greatest deterrent in passing policies. So if something seems too complex, if implementing it seems too overwhelming or too hard to follow, too hard to understand, or if there's too many steps, then often it will not get passed for that reason. And the third and last common factor in past policies is observability. So people want results. That's how they can improve. That's how they can show that things are actually happening and real positive changes occurring. So obviously something to track and real observable outcomes are not only wanted but also needed. So now I'll go over to my interview with a social worker, Rhonda Quintana. This is somebody in my local area, and I asked about addiction and about prevention and what she wanted to tell people when it comes to that, because she works in the court system with all of this, so I thought it went well along. And she said that, well, along with this topic, and she said that humans will always be human. Although we may categorize people as addicts or abusers, they are all simply people. They are a member of somebody's family, etc. And she also said, because no one can always be completely satisfied, the systems are never perfect, but you may always try your best in your own small realm. So she was really big on the systems, the policies are not always going to be 100% effective. They're not always going to be 100% success rate, but you can make a difference with those policies and with your efforts in your own little area, in your own little world, in your own little community. And lastly, this was a really interesting study that I had to talk about and bring light to. Is it kind of goes to the predictor number 4 that I talked about. African American youth in the inner cities were put into this drug prevention program, and they wanted to see who retained the information, who was likely to go back to these classes and what were the outcomes from these prevention classes. So it says those with higher retention in drug prevention classes had, quote, lower family conflict and fewer family relocations. So automatically, people who retain drug prevention came from families that didn't move around a lot and didn't have a lot of family conflict. And those who had low retention rates were people who already viewed drugs and alcohol as less risky. And obviously, they had higher family conflict and higher family relocations. So retention strategies must be further researched to reach more effectiveness to those who need it. So the people who maybe come from less of a rough background will be more receptive to prevention, and that's awesome and that's great. But really, the people who are more at risk are harder to reach. So more research needs to be done about how to reach those who really need it and who are already predisposed to struggling more in life. And so that's what I learned, and here are my references. And thanks for listening.